Helping Seniors Television, all about improving quality of life for seniors. If you're a senior, know a senior, or plan to be a senior, then this show is for you. It's all about helping you develop your own aging plan so you can age actively and with dignity. Helping Seniors Television from the Helping Seniors Network of information, education, and resources.
I'm Kerry Fink. Welcome to Helping Seniors Television. This is the show from the Florida nonprofit right here in Brevard County that is designed to inform, educate, and connect seniors to the resources that will make a difference for them as we work our aging plans out. And on behalf of our president and founder, Joe Steckler, Nancy Deerdorf, our operations director, Karen Warnland, our information specialist, and our whole team that works diligently to make life better for seniors in Brevard. Welcome to today's show. I think you're going to get a lot out of this. This is a topic that is a bit sensitive, and it's a topic there's no reason to be sensitive about. Joe Steckler, our president and founder, retired Navy captain, always talks about the need to make an aging plan. And again, while that sounds like your teacher just asked you to write a thesis, more often we like to think about it in Florida. We understand what a hurricane plan is. It just means you want to be prepared. It does not mean you want to have a hurricane. It means you would hope the hurricane would go the other direction, back out to sea and not bother anybody, but you still want to be prepared and know how you'd react. And that's Joe's point about putting together an aging plan. You want to know how you would go when a different situation presents itself. And so we euphemistically and kind of a little bit humorously, to make it seem a little less intimidating, call it helping you get your ducks in a row. And today, this is one of those topics that you may not need for quite some time, or it may be something that you're looking at that is on your radar screen and something that you need to work through. We're going to talk about the hospice word. And that show title by itself is one of those that people sometimes can back away from, go, I'm not sure I'm ready to deal with that. But I assure you, you're going to get a lot out of today's program, because we have none other than Dr. Ryan Chapman, who is the medical director for St. Francis Reflections Life Stage, one of the true local hospice organizations that's here in Brevard County. Welcome to the show today.
Thanks so much for having me.
I'm so excited that you're here, because I asked you if we could call this show something like The Myths About Hospice, or Let's Demystify Hospice, because so often that word, to just put it bluntly, maybe brings a chill down our spine. It connotes some kind of finality or something, and maybe none of us, we're often procrastinators, and we just want to put stuff off that we don't want to deal with or talk about until we're there. And the one thing that I keep learning by hanging around Joe and Nancy, who by herself has 33 years registered nurse experience, and a lot of the people that we're connected to in helping seniors, there really is so much to gain and so little to fear by getting schooled in what's out there. And I think there's so many misconceptions about hospice, what it is and how it can help, that we might not talk about it until it's literally almost too late. And so you were kind enough to say, hey, we can go down that road. But I wanted to maybe start with a basic question. I don't want to assume that we even know what hospice is. I use this analogy like if we took a clipboard and walked in downtown Melbourne and asked 100 people, tell me what you think of hospice, we'd probably get close to 100 different answers. Some of them might be right, but let's ask the expert. How do you explain to people what hospice actually is?
And maybe that is one of the biggest myths of hospice, that many people think that hospice is a place where you go near the end. But the truth is, that's really not true at all. Hospice, I always say, is two things. Number one, hospice is a philosophy of care. So it's for a patient who has a very advanced illness and end-stage illness, or what we sometimes call a terminal illness. And for whatever reason, the treatments that were once being offered are no longer effective, or the treatments are actually now causing maybe more pain and more sickness than the actual disease itself. Sometimes the patients have been getting these treatments or these surgeries for quite some time, and they're kind of themselves wanting to focus more, let's say, staying at home with their family and not being in the hospital all the time, and not so much interested in the aggressive treatments to cure the disease process, which likely is no longer curable, and they want to focus more on comfort, staying at home, keeping their pain, anxiety, their symptoms controlled. essentially that is hospice philosophy. So if you're kind of in agreement with that philosophy, then you get the second part of hospice, which is hospice services. So again, hospice is not a place. The hospice services are delivered wherever the patient calls home. It could be at their home, their residence. It could be if they're living at an assisted living facility or a nursing home. But really, I want to say 90% of our patients are receiving hospice services wherever they live, not in a hospice care center.
So we could say, by exploding myth number one, we always think of it as it's a building that's, to be honest, someplace you go to die. And that's not really the case. In fact, I would possibly make an argument that hospice is really about quality of life, not only for the patient, but those people who are around them. Is that a fair way to say it?
Yeah, that's definitely a fair way to say it. And I guess that almost like leads us into another myth of hospice, that hospice now means I'm giving up hope, and really that's not the case. Of course, when we're faced with a terminal illness or a very advanced illness, that's a very difficult, extremely difficult time in somebody's life. But the hospice services are meant to support the family and the patient, to allow them to be in their home during this difficult time, to allow them to focus on keeping them comfortable, making sure their pain is controlled, anxiety, maybe confusion, to really make sure that the symptoms are controlled, but then at the same time, giving support to the patient and to the family, so that we allow that patient to kind of have their wishes fulfilled, and it also allows the patient comfort in knowing that their family is being taken care of as well, to allow them to do this. So it's really trying to maximize that quality of life, not spending maybe whatever time they have left, could be weeks, could be months, could be longer, in a hospital setting, getting their blood drawn, poked and prodded all the time, hopefully in a more comfortable setting.
I was thinking as you were going through that one of the thoughts that comes to mind is that I know through the conversations we've had along the way that people wait to call hospice until the last few days of life. And then afterwards, once they realize how helpful hospice really is to the family, these families come back and say, I wish we had you guys come in so much earlier. And I wonder if that's because we are afraid to call in, or we don't know that we can call in, because it does seem like one of the other myths that comes up is, they tell us, I guess, to be recommended for hospice, they're saying you should have a life expectancy of under 6 months. And maybe that kind of note of finality is one of the reasons that we don't call hospice early enough. In your experience, I'm sure you've seen families who call you in early, and the outcome for the families and the long run is so much healthier because they're getting so much help through such a difficult time.
Yes, it's true what you said. That's when we follow up with our patients, or when we follow up with our families, afterwards, after the patient passes, and we do provide bereavement support for months and months, even up to 13 months afterwards. But that's one of the most common kind of statements that the patients that the families discuss with us, is that, wow, we really wish we called you guys earlier. And I think one reason is the support that we give them. Many times, we were kind of speaking a little bit earlier, patients and families feel like they're navigating this difficult time by themselves, a complicated healthcare system, a difficult disease process, and they're by themselves, and they see themselves not really getting better. But now you have a team of professionals who are guiding the patient, the family, in uncharted waters, and really helping them to kind of navigate the process. So kind of what I usually tell our families is, we want you to be there as their family, as their loved one, to give them love, and let us be the medical providers to do the medical care as you go through this process, educating them on what to expect, what not to expect, what may happen. And so we really, the education communication aspect is key.
I think our operations director, Nancy Deardorff, who again, 33 years of registered nurse experience, but who has been a caregiver in her family herself. And she said she reached a point with her father that she was so happy to call in help so that she could go back to being the loving daughter instead of having to be like this manager of everything going on. And when you look back on those times, isn't that something that gives a family peace? Like you just said it, you have really top quality expert medical care who can understand what's going on, react to everything correctly, but that lets you as the family spend that quality time with your loved one.
Yes, absolutely. It's whenever we can provide that to the family to allow them to, I think it helps them to be a little bit more accepting, but again, be the wife or the daughter or the husband. It's like one of the most priceless things we can give someone.
Yeah, and I think it's not only, I asked you this question, I said, I have a perception that sometimes hospice, it is for the patient. Of course, that's the primary focus of all the care and trying to make them comfortable and do well in all the processes. But it's as much for the family, because just having that hand to kind of guide you through it and say, when this is happening, this is what's going on, that makes a difference. I've seen it, in our own family when we called in hospice. And I think we learned the same lesson that you're speaking to. Like, I guess there's a natural tendency to want to fight and not give up, but actually taking that corner into hospice is really not giving up. It's actually being more fruitful. In fact, we talked about before we got on the cameras that studies often show two things. They show that people will live longer under hospice because all the symptoms, all those things are being correctly managed, the support infrastructure is there. And so people think I think we miss that there's a lot to the whole hospice team. It's not just the doctor, right?
Yeah, especially when the hospice or hospice or palliative care is called earlier in the process, because we focus on stabilizing those symptoms while they still can be stabilized earlier on in the disease process, versus when it's very, very late, very, very end stage. And really the best thing at that time is to keep the patient comfortable. So there's a very interesting study from the New England Journal of Medicine where there was lung cancer patients receiving either standard of care versus standard of care plus palliative care. And the palliative care patients, they did live longer, statistically significant living longer, even though they were at the very end receiving less chemo and less resources. And sometimes a very, very sick patient who maybe is not really able to get out of bed anymore, who is not able to even barely make it to their doctor's appointment anymore without them being lifted by two people. All the medications we have, there's always risk versus benefits to every medication, every treatment. And sometimes the treatments at that more end stage can cause more damage than help. Patients who are treatment candidates, who are still strong enough to make it to their appointments, definitely encourage them to get treatment to try to reduce the disease as much as possible. But there are certain times where, despite all the medical advancements we have, despite all the treatments that are out there, sometimes those diseases those treatments are really no longer prolonging the patient's life, and they're many times causing worse symptoms than helping the patient.
Yeah, it's funny. In my own life, I remember when my father had a terminal diagnosis many, many years ago. And I remember, and it was a lot younger then, and I remember him saying, I'm done with doctors. I don't really want to be in hospitals. I just want to go home and be at peace. And so in my mind, I thought, well, he'd made, in his own mind, kind of a turn to say, like, okay, I want to get at peace with this, as opposed to chasing the next doctor's appointment and all that. And I think one of the myths that I wanted to ask, or one of the perceived myths, is that I think we don't understand how much help we get from hospice, because all of a sudden, instead of running to the doctor is running to you, and they're making sure you and the family are okay. And now the schedule is really much more about what the patient needs, as opposed to when the doctor can shoehorn another 15 minutes in, or whatever that is all about.
So kind of like you alluded to, and what I definitely express to all of our patients and families is, although hospice provides all the medical equipment the patient needs, such as hospital bed, oxygen tanks, a walker, wheelchair, bedside commode, the medications are delivered. Although we do provide all that, and it's a huge benefit of convenience, the biggest benefit is now the team of people behind the supporting the patient, supporting the family. So you, again, like you said, the doctor, the nurse practitioner, the nurses, the hospice aides, the chaplain, the social worker. This is the team of people,
Right,
all supporting that one patient and family now. And they come to you. They come to you wherever you're living. Again, they come to your house and they listen to you. What you said, I think, is so important. Like, of what your dad's kind of wishes were. You don't have to be on hospice to people. Chronic diseases are so common now in the Western civilization, the Western world. These chronic illnesses that, for the most part, kind of over time, kind of slowly progress and don't always really get better. And so it's important for patients, and it's important for us as physicians to listen to our patients, to kind of hear them when they say, I'm really not so interested in taking all these medications. Maybe can you reduce some of these meds for now? Or can you, do I really have to go to the hospital for this test? Is it really going to make a difference? These are kind of important, whether on hospice or not. These are like really important questions that I would really implore all of our patients to ask to their doctors. Is this treatment going to really make a big difference in the end? And it's everything, again, is about weighing the pros and the cons and the risks and the benefits.
Well, I think another myth that I want to at least tackle is, because I was asking you this before we got on camera, I said, it seems like, do we understand that we might think hospice is an expensive service or something like that? Mm-hmm. And what I kind of follow, and correct me where I get this wrong, but not only is it a service that is available to basically everyone that you don't have to pay for out of pocket. In the long run, I think you said some studies could show that people who tried to go down the road of managing everything of their own, it was significantly more expensive because they're still having to pay for medicines, they're still having to pay for supplies, they're still having to pay for appointments, transportation, all the things that go with it. And then, because they're in that mode, they're not getting any of the benefit of all the other support that comes with hospice. Like you talk about the team that's there to help you and help the family work your way through the whole time.
Yes. So when they compared patients who had the more or less similar diagnoses, both sets with terminal diagnoses, patients who were receiving hospice care versus not receiving hospice care, the patients who were not receiving hospice care were much more likely to end up in the emergency room, much more likely to be hospitalized, and also usually had a lot higher insurance bills and higher cost of care overall. And then kind of to like tackle the first part of your question is that, really you should not have to pay anything for hospice. That's the truth. Hospice is hospice care, hospice services, all the care that I mentioned, the team of people, plus the medical equipment and the medications. Really, that will be covered by Medicare, or Medicaid, or by vast majority of private insurance plans. And hospices really are mandated also to provide some charity care or non-covered care. And so our company, we never turn anyone away, regardless of the ability to pay or not.
That's so important. Now, I want to reserve a minute or two to ask specifically about St. Francis and kind of what sets you apart as leaders in this in our community. But before I get there, I did want to say, another, I guess, myth is that I just want to tag on. I think everybody assumes, and it is the purpose of hospice, that they assume that hospice is end-of-life care, but there have been people who graduate from hospice, and the point that I wanted to touch on there, or ask you to comment on, is the fact that sometimes because somebody's finally getting really good care,
yes,
it extends their life.
Yes, 100%. We definitely graduate patients, fairly commonly, actually. Patients sometimes are surprised. We say I think it's a saying in hospice that sometimes patients live longer on hospice. We kind of mentioned the lung cancer study patients, but also patients who have some sort of dementia-related condition, maybe from strokes or maybe from Alzheimer's dementia. But you hit the nail on the head. Whereas now you have an extra team of people. Another set of eyes who are providing wound care, who are doing turns more often, who can help with feeding, spoon feeding. That we're very patient with the cold feeding process, and also making sure they're getting their medications on time, making sure that their pain is controlled. These things can all lead to the patient actually perking up a little bit or a lot, and can really have improved outcomes.
Yeah, and that leads me to a question because I was telling you in my own personal family situation that I ran into the term palliative care for the very first time in connection with my mother. I knew about what hospice was, and to be honest, I was probably like everybody else. I don't really want to hear that word yet. And so the doctor sat down and talked to me about palliative care, and I asked you what the difference was. And I thought it was interesting how you explained it's really the umbrella over everything. Share that. I thought it was so important.
So the way I usually explain palliative care, the word palliative really just means to try to help the symptoms, try to help make the symptoms get better. So for example, you could receive a palliative radiation for a tumor to make the tumor go down to be less painful, or even palliative chemotherapy, which means that chemotherapy is no longer, is not curing the cancer, but hopefully decreasing the tumor burden. So again, palliative is just to help treat the symptoms, make the symptoms feel better. So what I say is that palliative care is the umbrella term, okay? And then hospice care is like a subset of palliative care where we're really focused on helping those patients' symptoms become controlled, but also because it is, because hospice in the United States is an insurance benefit as well, it's for a subset of patients who qualify having an end stage or terminal diagnosis. But then kind of the remainder of palliative care, it's much more broad. It's really for any patient with an advanced illness, for the patient and for their family, focusing on the symptoms to be controlled, also focusing on quality of life still, also focusing on planning and communication with the patient to understand what's important to them and their family. And the other important part about this palliative care is that it can be received at any stage and any time of the illness. So it can be received at the beginning of the patient's illness trajectory, or kind of closer to the end, and we tailor it to that aspect.
You know, and that is something that your organization's St. Francis Life Stage Care, that is something you guys are active in both aspects, or all aspects, I would say, palliative and hospice care. One of the questions I would want to ask you is, as you're contemplating hospice and maybe whether it's right, or palliative care, whether it's right in your situation, you have a choice, right? You as a consumer, I always talk about this, the more that you as a consumer understand your options, the more powerful. Nancy Deerdorf has this expression. She says, knowledge is power. And she also says, how do you know what you don't know? So if you don't start looking at these when you're in a non-stressed environment, and like you're taking the time right now to watch this program and educate yourself on some of the misconceptions about hospice. But people have a choice. They can call you. And how do they know how to pick the right hospice?
Absolutely. So like in every county in the U.S., there's probably multiple hospice providers. Okay. We're all required to kind of perform a basic level of care and meet basic kind of rules and regulations, that kind of thing. But the patients absolutely do have a choice of which hospice provider they want to go with, you know? And I think that doing the research is important. So they want to make sure that they're a local company. I think there's a star rating for hospices throughout the country, a 5-star rating throughout the country for hospices, called the HIS. And that's basically it's based on surveys from the patients and from the families who have been on hospice, as well as certain criteria and metrics that the hospice is meeting. In the state of Florida, there's no 5-star hospices in the state of Florida. In our county, Brevard, we're only one of 2 hospices that have a 4-star rating. So that's something that the patients can look up as well.
Yeah, and I think one of the things that I really found intriguing when we were talking about before this is that you really are kind of Brevard born, raised, and this is home. So I love it because I explain to people, like, a lot of times, not so much in category of hospice, but a lot of times when they're seeking out ideas or help in various things connected to senior living, there's a great tendency to want to go and look something up online and try to search it out for yourself. Or maybe you saw a TV ad and you're calling some 800 number, and those people may want to help, but they're in a call center in Des Moines, Iowa, or something, for example. And it's really nice when you can sit down with somebody eyeball to eyeball who's local, who knows everything, what the resources are, what's available here in town. That makes a real difference, I think, in the quality of care.
I think so too. We're as you mentioned, we're local. We're the only not-for-profit, independent not-profit hospice here in Brevard County. We only serve Brevard County. As you mentioned, I'm the medical director and chief medical officer, but I also round locally at Parish Medical Center, at Rockledge Regional Medical Center, at Melbourne Regional Medical Center, and I'm seeing patients and talking to families, with my own eyes, and so are all of our other providers and physicians. And so if there's something maybe that needs to be approved that maybe hospice typically does not do for patients, someone in our company just has to call me. Or me or my boss, and that's pretty much it. So we can get things done very quickly for our patients to really help that transition at a tough time.
Yeah, I know we're going to put on the screen here the numbers and how to get in touch with the hospice, and if they want to talk to St. Francis and learn some more. What would you say? We just got like half a minute left, but how much? What would you suggest somebody that want to learn a little bit more? What would be a good way for them to gain expertise in this area?
So definitely, starting with, I think, with our website, which is reflectionslsc.org. Okay. Starting there, they can get a lot of different contact information. Something that maybe many people don't know about is our phone number is on that website as well. They can contact us. And again, the planning process is so important. It just allows a very difficult time to be less difficult, and sometimes even a beautiful time, to support. But so we can do like what's called informational visits.
Oh, good.
Informational visits the patient and family do not have to be ready for hospice yet. It's just kind of an informational visit to learn more about what services are offered, what is not offered. Requesting a palliative care visit, kind of just touching back on palliative care, that will basically send one of our nurse practitioners out to their house. We do community home visits, speaking to patients and family members. And the thing with palliative care, as I mentioned, is all the regular care that they're getting, whether it's chemotherapy or surgery or even a transplant, none of that stops with palliative care. They kind of continue with palliative care as they're getting all their usual regular care too. And we'll have those conversations with them.
No, it's so good. Well, we've been talking with Dr. Ryan Chapman, who is the medical director for St. Francis Life Stage Care. And thank you, viewer, for joining us for this edition of Helping Seniors TV. We'll see you next time.
I'm Joe Steckler. Thank you for joining our program today. I'd like to remind you that our senior information line is available to you at 321-473-7770. There you can get help and direction that could be helpful for your specific situation or circumstances. The work of helping seniors is very important, but we can't do it alone. That is why our sponsors here in Brevard County are so important. I'd like to thank our many area sponsors, businesses and medical providers who support the mission of helping seniors that help us carry the cost of our media efforts. If you'd like to join us either as a business partner or simply donate as an individual, we welcome your call at 321-473-7770. You are always welcome to visit our website at www.helpingseniorsofbrevard.org. Thanks so much for your help. It does make a difference.